includes shocks, first aid, physical support, choking, also some myocardial infarction like stroke. Okay, and then later on we will going to have our exam.
Yeah.
Okay lang siya, multiple choice.
There's multiple choice, there's also enumeration.
Service lang yun. Konti lang sir.
The enumeration, madali lang siya. Okay, before we will going to have our exam, we will give at least a small demonstration, like every one of you should have. Okay, like for BLS, like how we're going to respond to a victim. So now we're going to have our topic for shock. Basa pa lahat. Did you read?
Yes.
No. Can you hold the blanket? I forgot my blanket.
Yeah. Okay, yun lang sa may pinasa sa may.
Remove pa daw. You can see yes. So what is shock? Shock is an impede or obstruction of the flow of the blood through the tissue. So it is a lack of oxygen passing through the tissue. So if there is no oxygen, so there will be no perfusion. So it means your organs will not going to work well if there is no oxygen. Okay, so means shock is decrease in auto perfusion to the tissue. Decrease oxygen perfusion to the tissue. Okay, so we have types of. Hindi ka natin Okay, so we have these 5 types. Of shock. Okay, number 1 is
Hypovolemic shock.
hypovolemic shock. From the word hypo means
Below.
low. Vol means
Volume.
volume. Emic means blood. So it means a low volume of blood. So what is the cause? For example, is bleeding. Even if it's internal or external. Okay. Internal means you have GI bleeding inside intestinal, gastrointestinal bleeding. You don't know this one. Sometimes you have bleed in the brain. Internal or external. External, you can have, like, for example, stab wounds or a trauma. Like you already amputated. Okay. So they say, like, if it's more than 300 cc of blood, you are considered to be hypovolemic. Okay. So what is the management of hypovolemic shock? The correct way to replace or compensate the volume loss, blood loss. Fluid resuscitations to include IVs. Okay. So management, fluid resuscitation or IV. Okay. Because if your patient, you will just allow your patient to drink Gatorade, to drink only water. It is not enough. Okay, the fastest way, considered the correct way to correct the hypovolemic shock is to introduce IV fluids, fluid resuscitation. Okay. Nakuha ang hypovolemic shock? Okay, hypovolemic shock means low blood. Okay, causes like bleeding inside or outside of our body or trauma. Okay, the management will be fluid resuscitation. Okay, that's why if you have come with cases like patient come rush to the ER with hypovolemic shock or like for example GI bleeding, the doctors will immediately order for fluid resuscitations at least like 3,000 ml bolus continuous, no regulations. Okay. And also, patients like doing for surgery, they tend to have a hypovolemic. So that's why doctor may order earlier before the surgery, they will order for blood transfusion. Okay. So this is number one, hypovolemic shock. Number two is cardiogenic shock. Okay. So cardiogenic shock, what is the problem here? The problem here is the heart itself. So the heart is able to pump or there's a defect in the heart. So that's why there's no enough blood that can supply to the tissues or to the organs itself. So that's why there will be cause of cardiogenic shock. So the problem here is the heart is the problem. Okay. Your heart is okay. So, what's the management for cardiogenic shock?
Oxygen therapy.
Oxygen therapy and also surgery. Okay. Later on, you will have surgery, operation, if you have any problem with your heart. But mostly for the first line management, it is the oxygen therapy. Okay. O2. And then, and later, surgery. Okay. Vasopressor, like for example, dopamine, vitamin. Okay, these are examples of medicines for vasopressor. Vasopressor means the actions of the medicine, they tend to constrict our peripheral veins. It is not directly to the heart. They tend to have a function to our peripheral veins. Peripheral veins means away from our heart. Like for example, your heart is unable to pump. So they will give the vitamin or dopamine. So our veins away from our heart will constrict so that all the blood comes out to give a supply to other tissues. Okay?
Nakikita po ba yan, sir, sa x-ray yung cardiogenic shock? Or hindi?
Cardiogenic shock, nakikita siya. Like for example, for tamponade. Like a newborn, pinanganak sila, they have already like tamponade. Means the defect in the heart is parang mali yung pagka-flow ng heart nila. So that will lead also for cardiogenic shock. But they call also tamponade. Like that. Okay, tamponade means it is blockage of the heart flow. It is a, what do you call this one? Newborn. It is inborn for them. Parang they already have heart defects. Okay. Remember this one, okay? Number one, hypovolemic shock. Bleeding internally. Like for example is GI bleeding. GI bleeding is gastrointestinal bleeding. Means yung stomach nyo. So like for example, yung ulcerative colitis, like nabubutas na yung tiyan nyo. Okay, or cancer. Okay, so GID, we don't know, okay, hindi alam ng pasyente, pero bleeding siya sa loob. And then you will know, parang mababa ang BP. The patient already have a low blood pressure. So this will tend to have hypovolemic because there is a bleeding inside. Okay, remember the management will be fluid resuscitation. Okay, fluid resuscitation in terms of fluids inside vein, IV directly. Okay.
In addition to, also one thing in addition to GI bleeding, you can also detect the bleeding inside of the GI tract through laboratory examinations. One thing is your stool examination. For example, in your fresh stool, if you submitted the one stool specimen, stool, you know stool, right?
Yes.
It's a disease, okay? Once you submitted the specimen stool in the laboratory and then we examine under microscope, if there is a blood in presence macroscopically, meaning there is a lower GIT bleeding, meaning sa daanan. But if it is too dark, when your stool is too dark, and then we can see also there's a blood, ibig sabihin upper GIT. So how do we detect upper GIT? By the test using occult blood test, fecal occult blood test. Occult blood test meaning behind or nakatago, hidden. Ibig sabihin hindi mo makikita yung dugo sa loob ng stool. You cannot see the blood present in macroscopically, even microscopically under the microscope for the stool. But you can test it using testing kit for occult blood. Occult blood, ibig sabihin hidden. So upper GIT yun, may dugo. Yun, nagbi-bleeding siya. Kaya sometimes if you check your stool, kapag may reddish, ibig sabihin presence of blood. Kapag too dark, sa pinakadulo, ibig sabihin may something is wrong. So it could be something is bleeding inside. Kaya kailangan mo magpa-stool analysis. Lalo na kapag formed, usually sometimes, pag form matigas ang stool natin, if it is too formed or too hard, ibig sabihin sometimes may trauma or ang daanan ng
Impact.
So by bleeding something, freshly blood, gano'n. Pero pag matigas din talaga, tapos wala namang dugo, pero color black talaga, something is wrong. Could be, depende naman kung sa diet ninyo, or sometimes may bleeding talaga sa loob. Kaya you undergo stool analysis or stool examinations. Yun lang.
Okay, going back. Cardiogenic can be caused by surgery, yes or no? Like for example, the patient is having a surgery and they tend to have a cardiogenic shock. Yes or no? Yes or no?
But
Like for example, your patient is underwent surgery. Is it possible that the patient can have cardiogenic shock? Yes or no?
Yes.
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 May
It can be, but mostly there will be no cases for cardiogenic shock. Okay, cardiogenic shock happens only if the patient is like in a living state. Okay, means there will be no like in a, like for example, if it's in a medication, there will no happen in cardiogenic shock. Only happen if the patient like abruptly dysfunction is hard. Okay. It is not undergoing treatment like you are going to have cardiogenic shock. Okay, you can have hypovolemic shock other than the shock, but cardiogenic shock can happen only if you are living in a living state. Then happen like example, parang biglaan lang siya.
myocardial infarction.
Same like myocardial infarction. Okay, it is not like you are in under surgery and you are going to have cardiogenic shock. Okay. So no. Okay. Number 3. Septic shock. Septic. What's the meaning of septic? Septic comes from word dirt. Means marumi. So the cause will be. What's the cause? Infection. Okay, like for example, you didn't treat yourself for any antibiotics. So mostly, the body reacts itself, you will get high fever. So after high fever, if you didn't still get any treatment from antibiotics, the microbes or bacteria will going to accumulate, and this will lead to a distribution to your body. okay, to any particular, that will lead to septic shock. Okay, sometimes patient is purplish, reddish. Okay, and para edematous means the patient's already like manas. Okay. So what is the management? Oxygen and septic shock.
Oxygen and fluid resuscitation.
Antibiotic. Okay, number one is antibiotic. Okay, like for example, if you are caring for a patient with septic shock, remember to check the doctor's order that they should have an antibiotic order. Okay, number one priority is to administer antibiotic. Okay. So, tapos na tayo sa 3, septic shock. Number 4, what's number 4? Si Ana. Anaphylactic shock is, what's the cause? Allergy. What's the management? Adrenaline. What's the route of adrenaline? Route. How will you give? Intramuscular. IV, directly. Okay. Remember, if you see an adrenaline patient who is carrying adrenaline, means your patient may have an allergy to any food. Okay. This is the pen. This is pen, pen. This is color blue. Blue in the sky means blue should be up. Orange should be to the skin. Okay, baka you will going to hold the orange, and then when you put like this one, you get punctured. So you and the patient will go to the hospital at the same time. Okay, remember, blue is the sky, orange would be the skin. When you're giving for the IM, intramuscular adrenaline, you just have to press the blue. Okay, directly to the thigh. Intramuscular. Number 5. Neurogenic shock. What's the cause? Disruption of SNS. SNS means, what's the SNS? Sympathetic nervous system. So it means the nerves also, the nervous system is also responsible for the pumping of the heart. If you have a trauma, like spinal cord trauma, and then your sympathetic nervous system is disrupted or damaged, it means there's no signal connection to the heart. Okay, the signal is damaged from SNS to the heart. So it means your heart will no longer function. There will be a function, but however, they should treat first the nervous system, the sympathetic nervous system. Okay, what's the and same with that. Okay, same with the cardiology. There's also actually all for the shock should have fluid resuscitation. But for hypovolemic shock, number 1 initiated, fluid. Not like cardiogenic, oxygen, then later surgery. Neurogenic shock, like for example, when you are treating positioning for neurogenic shock, how will you going to position the patient if the patient is is in a state of shock? Benjamin. Okay, when you are positioning patient in neurogenic shock, you should put the head supine. Okay? And then the legs elevated.
Parang high poses.
Hypo.
Do you know what supine position means? You guys know what supine position is? Supine position, nakaganyan, nakatihaya. Yung patient nakatihaya, tapos iaak yung pa. Para yung oxygen flow, yung blood flow babalik.
Mabalik. Okay.
Magaling. Same sa mga hilo.
Okay, so that the blood will going to push to the heart. So that and the heart is going to distribute.
Hindi, you can relate again.
That's good position, okay?
Ilan na? Nakompleto na?
Yes,
Kompleto na. If you were going to find like distributed shock can also have to can be identified like eccentric shock and neurogenic shock. Okay. Anyway, I'll just make a simple things. I think 10 questions only.
Everybody got it. You understand?
You understand?
Yes.